Welcome to the Kansas Department for Aging and Disability Services training on strategies for providing physical assistance to someone with brain injury. This is part of the brain injury series for care providers who are providing support for individuals with brain injury. Before taking this course, you should have taken the Brain Injury 101 course to get a background on brain injury and the different strategies that are going to be covered in today's course. There are two other courses that go along with this one on providing cognitive strategies and emotional and behavioral strategies. And we're going to dive into the physical assistance part in this course today. By the end of the course, we are hoping that learners are going to be able to identify why someone with a brain injury will need physical support, describe how to safely provide physical support to someone during daily activities, identify 2 to 3 environmental modifications that can support a person in their home, and apply cueing strategies to activities requiring physical support. This course is going to include 5 sections. First, we're going to talk about why someone with brain injury might need physical support. Then we're going to provide an overview of how to provide safely physical or hands-on assistance. Then we're going to talk through environmental strategies that can support someone who needs physical support. And we're going to talk about how cueing and physical support can be used together. Finally, we're going to talk about the relationship between needing physical support and cognitive and emotional behavioral support. And finally, we're going to end with talking about provider self-care. Section 1, why does someone with brain injury need physical support? There are many physical effects of brain injury. This can include things such as headaches, fatigue, dizziness, changes in vision, which can include blurred vision, as well as what's called neglect, where the person may only see part of their visual field, often to the left-hand side, which means that the person is really not able to see things to their left. Individuals might also experience sensitivity to light or noise, loss of taste and smell, hemiparesis, which is when the person loses function on one side of their body. This can be both in their arms and legs, or they may experience extreme weakness in both sides, maybe in the leg and in the arm. And it may be more severe in one limb than the other, but it will always be on the same side of the body. Individuals might also experience spasticity, which is where their muscles will contract without and they're unable to control that. Individuals might have delayed reactions, so not being able to move as quickly to respond to things in their environment, poor coordination, and also slow or slurred speech. Not everyone with a brain injury is going to have all of these different physical effects. However, somebody with a brain injury, depending on the location of their injury and the severity, might have multiple physical effects. It's also important to know that some of these physical effects are things that are present all the time, such as hemiparesis or loss of taste or smell. And there are other things that maybe will come and go, such as dizziness or fatigue or headaches. So it's important to recognize that somebody might be feeling different physically from day to day, depending on which different conditions they have. Now, there are a number of very specific strategies that can go along with each of these physical effects. We're not going to dive into all of those specifically, although there are some resources that will be linked at the end of this course that you can review some really specific recommendations for each of these. However, all of the strategies presented today are going to be ones that are really going to help regardless of what the physical condition might be, as they're going to help promote the person's ability to function and for you to be able to safely support them. So these different physical effects of brain injury can overall impact somebody's mobility, which is their ability to move around in their environment, such as walking, running. It can also affect balance, their ability to stand up for a long time, also known as their endurance, their strength, being able to react quickly. So that might be in the case if you trip and fall, oftentimes your body will help you catch itself. Somebody with brain injury might not be able to react quickly to catch themselves or hold on to something to prevent the fall. Physical effects of brain injury can also affect someone's ability to notice things in their environment. This is such as if somebody has lost their sense of taste or smell, or if they have neglect, they're not necessarily going to notice things around them, which can present with a safety issue. So what does it mean to provide physical support? Physical support or assistance means providing hands-on help or support to a person to be able to complete an activity. There are different levels and intensities of physical support. The level of physical support someone needs might change depending on the activity that they're doing. So somebody who needs a high level of support for one activity may not need that high level of support for doing something else. And this is again going to depend on what the physical effects of their brain injury are, as well as their endurance and some of the environmental strategies that might be in place. It's also important to note that physical support is often combined with different cueing strategies. These physical supports might be more effective if you're able to provide cueing to the person while you are helping them. And finally, the physical support needed is going to depend on the physical impacts of the person's brain injury. For example, somebody who's lost their sense of taste or smell does not necessarily need help moving around with their mobility, getting up and out of chairs, in and out of the shower, but they might need more support to recognize different cues in their environment. So it's just important to know again that not all strategies presented today will be necessary, but it's going to depend on somebody's physical impact. So a few important safety things before we really dive into the details of this course. The first and most important thing to note is that a provider should only give the amount of physical support that that you can safely handle. So if you are a smaller person, you need to be aware, and we all have limitations in our strengths, regardless of what our size is. So it's really important to know what is the limit that I can safely move a person, lift a person, stand behind a person to make sure that they're not going to fall. It's good to know what our limitations are. If we go past what our limitations are, we may injure ourselves and the other person while we're trying to help them. It's also important to note that certain activities might require more than one person to provide physical support. This is again depending on the severity of the impact on the person themselves, the strength, size, and ability of the person providing assistance, and how the environment is set up. For example, somebody who has hemiparesis and is unable to walk on their own and must use a wheelchair to move around is certainly going to present with difficulty going up and down stairs. So if the person does need to go up and down stairs, there's going to be extra things that need to be in the environment to make that safe, such as a wheelchair that can be moved up and down the stairs, 2 people, 1 person pulling behind and 1 person supporting in front to move that wheelchair, etc. So there are different circumstances and situations where it's really not safe for you as a provider to do it alone and you'll need some assistance. What's really great is that physical support can be combined with adaptive equipment to make the activity safer for the person and the provider. Adaptive equipment can be really, really helpful, both to increase the independence of the person, for them to rely less on another person for assistance, but also increasing overall safety. So it's thinking through all of this, you might be thinking, how do I know what physical support I need to provide? I'm not sure how much assistance the person needs or what the differences might be. The first thing that you want to do is ask the person what does or makes them feel safe during an activity or throughout the day. Folks with at least a general level of awareness probably have a good understanding of different things that they are able to do or not able to do, things that might make them anxious or nervous, or things where they feel like they need more support. That being said, someone with a lower level of awareness may not be aware of some of their physical deficits. For example, sometimes someone with the neglect, so not able to see to one side of their body, maybe the left-hand side, isn't always aware that they have this condition, that they have the neglect. In that case, as a provider, you are going to need to provide more physical assistance and environmental supports to cue the person that this deficit exists. Other folks, such as those who maybe have decreased balance or strength or decreased endurance throughout the day, are going to be very aware that they have that limitation and that they need support. So going back to that Brain Injury 101 training, thinking about where's the person's level of awareness and how much awareness do they have about their condition. That's important to think about as you're having the conversation with them about what makes them feel safe and combining those different pieces of information together. Additionally, if you're a provider and the person you're working with has worked with or is currently working with physical therapy or occupational therapy, OT or PT, talk to those providers. They're going to be able to tell you expected limitations or support needed, strategies that they recommend to compensate for physical difficulties, and environmental changes or adaptive equipment that might be needed or helpful. Working with OT and PT can be really helpful for you to get training on what the different strategies are, how to move safely, and different equipment recommendations that can support your physical assistance with the person. So I highly recommend, if you're able to be with the person while they're doing their OT or PT session, and have a conversation with that provider. Sometimes somebody's working with both. Have a conversation with those providers to get their recommendations and training as you're able to. So we're talking about providing strategies for physical assistance. Clearly, we're going to talk about providing physical support, but we're also going to talk about how cueing can support physical assistance, as well as different environmental strategies that, again, can help the person and you be safer. So section 2, we're going to dive into what it means to provide physical or hands-on assistance. The first thing I'm going to describe are the levels of assistance. Levels of assistance describe the amount of support a person needs to complete a task or activity. I'm going to go through these in detail, but it's important to note that this is really to help you understand a common language, especially if you're talking to the person's provider. So for example, we have things such as showering, cooking, paying bills, getting dressed, taking medicine. These are all normal things that a person might need to do throughout the day, right? As you can see, and as you're thinking about these different activities, you might be in your head, hopefully you're breaking down the task into smaller pieces, as we talked about in a couple of these other trainings. Thinking about some of these activities would probably require a lot more physical assistance if someone has physical effects of brain injury, such as showering and getting dressed, whereas other activities maybe don't require as much physical assistance, such as taking medicine or paying bills. Cooking kind of falls somewhere in between those. So it's important to think about for each task that there might be different levels of assistance required. So what are the levels of assistance? Starting with the most assistance, we have maximal assistance. This means that the person or the patient is contributing little or nothing towards the execution of the activity. So really expending less than 50% of the effort. This means that their strength, their movement, their ability is less than 50% for the activity. So this is going to be folks with lower strength, lower balance, maybe again with that hemiparesis. So this is where you as a provider are going to be providing a lot more assistance because you're making up for that difference. If somebody needs total assistance, this is the most assistance a person can require. It means the person is really unable to do any movement at all, less than 25% of the movement required to perform the activity, or they're not able to safely initiate it. So that means that it requires a caregiver, likely 2 caregivers, to support them and complete the activity. Then we have moderate assistance down at the bottom there. Moderate assistance is if the person requires more help than touching, so more than just guidance, but they're able to expend 50 to 75% of the effort to complete the activity. That means they're able to hold part of their body weight to get started and while completing the activity. So you're doing more than just touching or guiding the person when you're providing moderate assistance, but the person that the participant you're providing support to is able to hold themselves up to a certain extent as well. When we have minimal assistance, that means the patient really requires a small amount of help to complete the activity. They're doing 3/4 of the effort or more. This means that they're able to hold all of their body weight, but they might require some gentle guidance to initiate, to balance, or stay stable during the activity. So this can be a little complicated because you might think about somebody being min assist because they need help watching their feet, right? But that's a little bit more than touch cues. So there's a little bit of a balance when we're requiring min assistant. But the goal behind this, or the understanding about this, is that you're providing really light touch to help the person move or be stable or provide support or get started on the activity. So then we're going to talk about independence and modified independence. Being independent means that you don't need support for the activity in any way, shape, or form. So if you are someone who doesn't have different physical effects or cognitive effects, you're likely doing most of your activities independently throughout the day. When somebody has modified independence, that means that they're able to do most of the activities, but that it requires an assisted device. It takes longer amount of time for the person to do the activity, or there's a potential safety risk that they need some monitoring, but you're really not providing hands-on assistance when you're doing that. And then finally, the last level of assistance that we're going to talk through is supervision or setup. This should be similar from the Brain Injury 101 course. The supervision or setup is similar to the cueing of standby, which means that you're there nearby the person. You might be providing some verbal cueing, but you're not providing any type of physical contact. Maybe you need to help set up the items or the space, and this might be due to cognitive difficulties as well as physical difficulties, and you're there to help observe and cue the person along either through verbal cues, but you're not providing any physical support. So these are all the different levels of assistance. As I mentioned, it's not incredibly important that you memorize exactly what all of these are, but it's important to understand the language because the physical therapist might recommend, oh, this person in therapy today said, they demonstrated modified independence. And you'll know that that means that they were able to use a strategy to help get done what they needed to get done. So I'm going to provide a few examples of what this means for physical assistance, just so you have an idea of what this might look like. So for total assistance, right, someone who needs complete assistance to do an activity, this might mean that you're feeding them a bite of food. That means that you're putting the food on the spoon or the fork and bringing it up to the person's mouth and then putting it into their mouth for them. Maximal assistance, an example of that, might mean that you're moving the person from a wheelchair to the bed and that they're really not providing a lot of assistance to be able to do it, but maybe they're able to keep their feet on the floor while you're moving their body from the wheelchair to the bed. With moderate assistance, this means that you're maybe helping somebody step into and out of the shower or bathtub. So they're able to stand on their own 2 feet without difficulty, but for whatever reason need that support of stability, especially while they're stepping over something and lifting their leg onto 1 foot. So it's more than just touching the person, but kind of providing some strength to help them be able to do what you need to be able to do. Minimal assistance would be helping somebody tie their shoes, right? So you're not really providing a lot of effort, but for whatever reason, the person is unable to do that task. Maybe they don't have the fine motor skills, they're not able to bend over to be able to do it. So you're doing it, but you're not taking on the burden of really physically supporting them during the activity. Standby assistance, right? You're standing next to the person as they step out of the car to the walker. So you might be there holding the car door open to make sure it doesn't shut on the person, standing right next to them as they swing their legs over and push themselves up, holding on to the walker, but you don't actually touch the person. You just make sure that they're able to do it safely. And then finally, an example of modified independence is that the person uses a raised toilet seat on the toilet. And that means that the toilet seat is up higher and with grab bars, and this helps them push themselves up and down off the toilet so that they're able to do it without another person there. So these are just some examples. Again, you don't have to necessarily determine how much physical assistance a person needs and assign a label to it. That's something that the PT or the OT might do, but it's important again to know just to have that common language and to help you prepare for how much assistance you need to provide for the certain steps of the task or activity. So safety. This is really important. When we're providing physical assistance to someone, safety is incredibly important because if we're not careful, we're going to injure ourselves and the other person. So never provide physical assistance if you're unsure you're able to support the person. If you're not sure if you are able to safely move a person, safely hold a person, support their weight if they were to stumble, then you shouldn't be there by yourself providing the support. If you're feeling unsure or anxious, that's going to be more likely to cause an issue. use good body mechanics. We're going to talk through what that means in a minute, or different examples of that, but you really want to make sure you're taking care of your body while you're moving and supporting someone. That prevents injury for you, and again, overall makes it safer for them. And use supportive and adaptive equipment when needed. There's a lot of great options out there. We're going to talk about that under environmental strategies, but using that equipment takes the burden off of you and helps the person do something more independently without another person. And finally, if you have never transferred someone before or provided maximal physical assistance, right, that high level of support, ask the person's provider for a PT referral and for some training. So if this is totally new to you, it's really important that you have someone really be with you and show you how to do it to make sure that you're moving safely and moving the other person safely. So transfers, we're going to talk through what that means and what it looks like to be safe when providing a transfer. So first, what is a transfer? A transfer is a method of helping a person move from one surface to another, where the person is capable of helping and able to bear weight at least on one of their legs. So a transfer can be something when a person is moving in and out of their wheelchair to a bed, to a chair, transferring from one chair to another chair, from bed to a chair, right? So they're moving from surface to surface. And the transfer is the act of moving between those two spaces. When there's transferring, there's a few different things that can cause injury. One is if the person isn't alert or their alertness changes, right? So if the person is very focused, then suddenly they're feeling dizzy or drowsy. That can cause a problem while you're transferring because they're no longer going to be able to provide the support needed. Lack of preparation. We're going to talk about transfer preparation, but it's really important to take the time to get the space set up before you start moving and before the person starts moving. The client may also have a fear of falling. When somebody feels anxious or is fearful of falling, that increases the risk of an accident or injury occurring. And then finally, being in a hurry. It's more important to take your time and move safely than to try to go quickly. Using improper body mechanics, such as twisting. In this case, it is more likely to cause injury for you than the person, but if you injure yourself, that can cause a problem for the person you're supporting. And then if there are environmental complications, so if you're not wearing the appropriate shoes, if the floor is wet, things are spaced out too far, there might be certain things in the environment that increase risk. And finally, this is going to start to sound really familiar. Another cause of injury is not asking for help when it's needed. So I'm going to emphasize again, it's so important that if you need help, ask for help. So when might you need to assist someone in transferring? A transfer is required when the person has difficulty moving from sitting to standing, standing to sitting, mobility issues, or moving across surfaces. Or if the person is at high risk for falls. So again, this might be somebody who has hemiparesis and they don't have strength in one side of their body that makes them a higher risk for falls. Similarly, somebody who has neglect, not seeing that left side of the body, is again at a higher risk for fall. So continuing on with transfers, setup is the first thing that we need to do. Make sure that the surfaces that you're transferring to and from are as close as you can. If somebody's moving from the wheelchair to the bed, position the wheelchair as close to the bed as you can while allowing yourself enough room to move. Chair to chair, similarly, or even from sit to stand, making sure the person's walker is close to them if they're standing up to a walker. Make sure you have everything you need that before and during the transfer, have it close by. There's nothing like being in the middle of a transfer, you're holding up somebody and you need something at that moment in time. Make sure that everything is close by and safe. When you're getting set up with the person, give very clear, concise, and short directions before you start transferring and also while you're transferring. Going back to some of those cognitive strategies, if somebody also has cognitive impacts, you want to make sure that they understand what you're saying. And transferring can be scary for the person. The simpler that we give instructions, the more likely they're able to pay attention to them. So before you even once you're working on setup, before you start moving the person, think through a couple of things. Are there any precautions? Does the person have a feeding tube, other lines, IVs, things that you're going to need to be cautious of while they're moving them, perhaps a wound or a cast? Make sure, again, that you are able to support the person's weight and the assistance level they require. Also consider if there's more people needed. If there's more people needed and you're by yourself, it is not safe to transfer. Also the time needed, making sure that you have enough time to safely complete the transfer, and making sure the person is able to understand you and your directions. And you might have to practice a couple of times through before you start to make sure they understand the directions. And again, check the environment and make sure that there's nothing that's going to get in your way. There should be no clutter underfoot. There should be enough room for you to move, for the other person to move. Things like the arms of a wheelchair should maybe need to be removed, right? What's in the environment that could cause a problem, and making sure that you resolve that. So once you're ready to transfer, set up the area and the equipment that you're going to need. If the person is someone who has difficulty just following verbal instructions, going back to that cueing strategy of demonstration, show the person what you would like for them to do before you do it. So making sure that they've seen what they're supposed to do in addition to what you're telling them to do. Agree on timing. So if you're helping a person move to sit to stand, you might say, okay, we're going to count to 3 and then we're going to move. 1, 2, 3, move. You want to make sure that you both understand that you're going to end 3 and then move, right? Instead of moving on 3. So making sure that the timing is right. Maybe the person needs 5 seconds or 10 seconds to prepare. Whatever that is, needs to be clarified before you start. And a good rule of thumb is counting the 3 before you start transferring. But again, you can take a little bit more time if the person needs a little bit more time. And then finally, when you're transferring, never let the person hold onto your neck. That's very unsafe for you, unsafe for the person, and is a high risk of injury. When possible, have the person move towards their strong side of the body. So if they have something such as having paresis or neglect, say the left side is their less strong side, their weaker side, it's going to be safer for them if they move to the right. So parking the wheelchair to the left of wherever they're transferring to so they can move to the right. All right, so as I mentioned, we're going to talk through body mechanics. Body mechanics are how you hold and move your body to protect it from injury while you're doing different physical tasks. So body mechanics for transferring include keeping the person close to you. The closer they are to your body, the less likely you are to cause injury to your neck, to your abs, because you're able to use your whole core for strength. You want to keep the person facing you. You want to keep your knees bent. You don't want to lock your knees and you don't want to straighten your legs. Use your leg muscles as much as possible instead of your back muscles. When we put all of our weight or use all of our back muscles, that's again when we increase risk for injury. Your legs are very strong. Use those muscles, and that's helped by keeping your knees bent. And then as much as possible, keep a straight neutral spine. Try not to curve too far forward, arch your back backwards, or twist while you're moving. You want your spine to try to be straight up and down as much as possible. Your feet should be about shoulders width apart. You don't want them too close together. A wider stance is going to help provide you more stability and support. You want to keep your heels planted firmly on the ground. Avoid being on your tiptoes because that's a good way to be off balance. And again, avoid twisting or rotating your trunk. So that's your spine, your stomach. Instead of twisting, take smaller steps in the direction that you want to go and moving your body so that your spine is staying straight and you're moving kind of your whole body together as opposed to twisting. So your feet and should always be kind of aligned with your shoulders. And then finally, avoid combining movements such as rotating and bending at the same time. So if you're bending over to support this to someone to get in a good position to lift them, make sure that you're up standing, again, with your knees bent, and then take steps side to side instead of sort of picking up the person and turning your back right away as you're moving. So this is what this safe or good body mechanics during a transfer can look like. So in this first image here, right, we see that the spine is straight, although she's a little bit bent over to reach the person. Her spine is straight, her knees are bent, her arms are underneath the other person's armpits, and the other person is not holding them around the neck. In this image here, again, the person is not able to provide a ton of support, so their arms are down by their side. The person who's transferring, the provider, their knees are still bent, their spine is still neutral, but they're now standing up more and they're holding the person that they're transferring closer to them. And then in this third picture, it's not a moving picture, so it's harder to tell. But what that's trying to show is that the person took small steps to move from the position of facing the bed till they were aligned and straight with the wheelchair that the person was sitting in. So the person didn't twist or turn, but they moved their whole body in the direction that they needed to go. So some additional strategies that can be helpful for somebody who needs physical support include pacing. Pacing means to avoid rushing and keeping an even speed throughout the activity. So sometimes people who have physical difficulties will try to rush or do something quickly. I have a lot of energy, I'm feeling good right now. Let me just go really fast and get this done before I get tired. But when we do that, when we rush too much, we increase the risk for causing an injury such as a fall or slipping or being careless, but it actually tires ourselves out more. It's much better to keep an even speed. I always say, help remind my clients, slow and steady wins the race, right? Being that turtle, keeping an even speed gets you to the finish line without being overtired or injuring yourself. Using deep breathing. I've talked about deep breathing, I think, in every video because it's one of the really essential strategies, both for emotional regulation, but also for actual physical support. You want to make sure that you breathe in through your nose slowly and breathe out through your mouth. If the person is breathing in and out through their mouth, they're actually not getting good air into their lungs. That can make them feel out of breath much more quickly and can cause strain. Similarly, we don't want to hold our breath while we're doing different movements because that can also cause strain and injury. So trying to keep that breathing going in through the nose and out through the mouth, even if you're breathing more quickly, it's still better quality breath in through the nose and out through the mouth. And then taking breaks as needed. So this might take a little bit of trial and error to figure out, but as the person's going throughout their day, it's important to start noticing, when do they get tired? Are there times of day where they're feeling much more fatigued, less coordinated, that they're getting headaches, whatever the physical issue might be? Is there a time of day where that tends to be worse? And that's a good time to plan for rest because we know that we're not going to be at our best to do a physical activity. It's also important to know how long a person can do something before they're tired. So again, if you start to do something, set a timer one day and see how long the person can be up about their day doing different activities. So maybe in the morning, getting the person up, getting showered, getting dressed, brushing teeth, going through hygiene. At the end of that, if that's something that takes an hour to do, is the person already worn out? Are they already tired for the day? And think about how you might be able to take breaks. For example, the person might take a shower, but then they might sit for a minute and read while wrapped in a towel or a robe before getting dressed to provide a little bit more rest and to keep them from feeling exhausted by the time they're done with their morning routine. You can also think about breaking up these different activities. Maybe it's better for the person to shower at night, so they only have to worry about getting dressed and doing hygiene in the morning and are not feeling so tired at the beginning of their day. Everybody's levels of energy and fatigue are going to be different, in part because of the brain injury and in part because some people are morning people or night people. So paying attention to where different energy zones are throughout the day and when physical symptoms are more bothersome, and planning to do easier activities or rest during that time and doing the harder, more strenuous activities while the person is feeling better. So for section 3, we're going to talk about using cues with physical supports. So we just went through kind of a lot of strategies and different ways that we can provide physical support to a person with brain injury. Because there's a high chance that somebody has cognitive impacts along with the physical symptoms, cueing can be really, really helpful to make these physical supports more effective. When you're giving physical assistance, it's really important to give communication. This helps the person know what they need to do next with their body and know what to expect from you. It's very startling for someone to touch you and you're not expecting it, or to not be sure about how the person is going to touch you, right? It's very intimate to have somebody help you like moving from the toilet or moving into the shower, right? So that communication is really important to help the person know what to expect, and also be able to anticipate what's coming to prepare their bodies, their minds, and maybe some strategies. When you're providing cueing while the person is receiving physical assistance, this is helping them learn those strategies and relearning how to move safely. So I'm going to run through the strategies that we learned in the Brain Injury 101 course and really apply that to what that looks like when providing physical assistance. So when we're giving demonstration to someone, right, we're showing them how to complete the task while it's happening, or you might provide a demonstration before you get started. So going back to our example of transferring, you might show the person how to move before they transfer. When their demonstration can be so helpful because somebody who has poor awareness of what their body is doing or poor control over their body or more weakness, it can be really, really helpful for them to see what their body needs to do before they do it. So seeing it and hearing it helps them learn, helps them process that information and potentially remember that information better. And the person can see what's going to happen, right? So what's the expectation? Where am I supposed to go? If I know what the end point is, it makes it a lot easier. And it also helps to make sure that you're prepared. If you are demonstrating what the person is supposed to do ahead of time, it sometimes helps recognize, oh, wait, we didn't put this in place. Oh, this isn't quite ready yet, or this isn't in the right spot, making sure that you're ready to go before they start moving. And when you're demonstrating to them, it helps bring attention to the different areas of the room, different strategies that might be in place, or different components of the space that the person might not have recognized on their own. Direct cues, as we remember, is giving an instruction 1 or 2 steps at a time. So this again can accompany any sort of physical assistance, even if you're doing something like moderate or max assistance. Physical assistance can be accompanied by this verbal cue. While you're maybe supporting the person, you might say, lift your right leg, then put your foot into the pants. Again, if somebody has issues with coordination, attention, body awareness, giving these really direct instructions is going to help them know how to move their body, and it's going to reteach their body how to move the way that they need to. You might also give them a hint or a short redirection. Your toothbrush is ready. What do we do with it, right? And that's a cue to someone to bring the toothbrush from the sink up to their mouth and start brushing the teeth. This can be really helpful for people who have difficulty with initiating action, who might be a little bit more disorganized, both again because of cognitive function and physical function. It's cueing the person to take an action and a movement. Gestures are incredibly useful when providing physical assistance. You might tap on the person's hand let me start that over. You as the provider might tap your hand on the bed where the person will need to move to from the wheelchair. So tapping on that space brings attention to where their body needs to go and helps them see where they're moving to and builds that awareness and preparation. You might also point to different objects to help the person recognize what they need to do. One example of this is you might point to the wheelchair brakes to remind the person that they need to lock them before they get up out of their wheelchair. Or you might actually touch the person themselves, right? And so this is maybe min assist or some standby assistance. So you might tap the person on the shoulder and say 1, 2, 3 to help the person make a movement towards standing. You might not actually have to help lift or push them up to standing, but doing that tap on the shoulder is going to help their body know that they need to get going and cue them to begin that motor action. Indirect cues and guided questions, again, are things that you're not directly telling the person what to do, but you're helping them think through the movement before they do it. What do we need to do before we stand up from the wheelchair? That's a cue again that the person needs to lock their brakes and do that motor action. So it's helpful again for cueing that cognitive awareness as well as the physical movement. Where do you grab onto before standing to step out of the shower? Again, you're prompting the person to use an adaptive strategy, such as holding onto a grab bar for safe movement. So you're not showing them or telling them exactly where to do it, but you're helping them problem solve and identify that. Getting to this point can be so helpful because you're helping the person learn how to move in a new way and also problem solve, so that if you're not with them, but a similar situation occurs, they can stop and think about maybe what they need to do before they move. When you're providing observation and standby support, again, we kind of talked through this earlier, you might be walking behind the person while they use their walker to go from the bedroom to the living room. The person is walking on their own. They're using the device of the walker, but because of balance issues, or maybe they're not feeling as well, you're going to walk behind them so that if they do start to stumble or trip or get tired, you're there to provide some support as needed. And you're only going to interfere when there's a concern for safety. So if maybe you gestured to the person to lock their wheelchair brakes, but they haven't done it yet, then you might step in with a more direct cue. Hey, you need to lock your brakes, or you may actually lock the brakes if the person has started moving already. But you're there and you're not going to do that unless the person doesn't do it and it presents an issue for safety. So section 4, we're going to talk about different environmental strategies. These, again, as a reminder, environmental strategies are things that we do in our environment to set up for success for the person, right? So these are things external to the person, but making the space that they're in safer and easier to navigate. One really key environmental strategy is getting prepared ahead of time. Again, you're going to see some familiar suggestions here, but getting organized in preparation really prevents so many different problems. Get everything you need before you start. Keep things close by so the person doesn't have to move around as much, and storing things together. So again, especially if somebody has issues with endurance or fatigue, they're not going back and forth or all around the house to gather what they need. If what they need is all together in one spot, that can really be helpful. Keep the home organized. This doesn't mean it has to be the neatest house you've ever seen, right? You're not going to be on HGTV or something like that, but you really want to keep things organized, again, to help the person cognitively be able to find what they need, but also move more fluidly throughout the task and reduce risk of falls or getting tired. So you want things that are used frequently to be stored together, such as in this picture, right? I leave the house, I need my watch, my sunglasses, my purse to go out. All of these things are there together for the person. You also want to keep things, especially if the person has balance, movement, coordination, strength or endurance issues, maybe hemiparesis again. Keep things so that what the person is using frequently are easy to reach and access. You want to prevent the person from having to reach too high or step up on a step stool or bending too low if there's not support. So if the person is often making sandwiches for themselves, right, you want maybe the cutting board and the silverware all to be together in one spot instead of having to get down into a drawer to get something out. And then you want to make sure that pathways are clear. So try to minimize clutter as best as you can, especially around the edge of the bed or other spaces where the person is standing up and moving, such as around the couch, or maybe they have a favorite chair to sit in hallways where the person is walking back and forth. Try to keep items out of that area so the person has a very clear walk space to get through. Can make it easier to see where they're going, can make it easier to use a mobility device and prevents the person from tripping or falling, especially if they're not very good at noticing things in their environment. One of the main areas or spaces of the home that need to have clear pathways is to the bathrooms. We know that everybody's going to access the bathroom throughout the day, so there should be some clear pathways from the kitchen, the living room, the bedroom, into the bathroom. Now I'm going to talk through home modifications, and I think this can be really scary sounding because there are certainly a lot of ways to spend a lot of money on home modifications. The ones that I'm presenting today are generally more recommended and usually not at the higher end. If you're interested in doing really intensive home modifications, you can certainly work with an OT or a home modification expert to be able to do that. But these are all things that you might be able to do either on your own or as a small project with a contractor. If you have stairways entering or exiting your home, see if you can install ramps to get in and out of the house so the person doesn't have to go up and down stairs. Any stairs that there are inside or outside, make sure that there are handrails and that these are secure. Adding non-slip tread to stairs, I'm going to show a picture of what those look like in a moment. And adding contrast at the edge of stairs and in transitions in the floors. Adding contrast is really helpful to see where the flooring might change. So if you have a room that goes from carpet to tile, again, if somebody has decreased vision, decreased motor control, balance, these transition areas can be really tricky for the person to move through. Providing that contrast is a cue. The floor is changing, prepare for things to feel a little different. Non-slip maps or tread in the bathroom and showers. Again, those are spaces that get damp and really slippery that can prevent slipping, and removing rugs if they're really loose, or a lot of people don't want to give up their rugs, securing them with some non-slip treading. And I'm going to show again some pictures of all of these in a moment. If you're feeling overwhelmed by all of this, focus on the areas of the home that the person uses first. Again, the bedroom, the bathroom, and maybe the living space. Especially if you're on a limited budget, you might not be able to do everything at once, but the areas that you know are going to get used, try to implement some strategies there first. So again, home modifications: clear your pathways and hallways, remove cords and other tripping hazards, add grab bars if you can in the bathroom and the shower. Make sure there's adequate lighting. Sometimes you just need to change a light bulb or buy a brighter type of light bulb, add a lamp or a night light to make sure that the person is able to easily see. And then have sensor detective night lights in the hallways or bathrooms. This is a really great strategy to prevent falls, especially if the person has to get up and go to the bathroom at night. The lights don't come on unless there's movement, but it can help make sure, help the person see their pathway as they're moving. And then changing the light bulb. So if somebody is really light sensitive, gets headaches or migraines really easily, we might need to change the light bulbs so that they're not as triggering for that. On the other hand, if somebody has some low vision issues or again has that neglect, changing out the light bulbs to be brighter or different colors through lamps or overhead can help cue the person to different areas of the room. So I'm going to go through some pictures of these different home modifications. So you can see in the first picture, there's a yellow stripe at the bottom of the stairs. That provides contrast so that it's very easy to tell where the edge of the stair is. This can be really simply done. You can buy special tape for that, but you can also use colored duct tape and just make sure that it's very secure. You can use the same strategy in between rooms or any space where there might be a tripping hazard. Also shown is a shower with different grab bars in it. The shower has a lot of grab bars. You may not need all of these, but figuring out where the person needs to hold on to get in and out of the shower safely or up and down from a shower chair. I love the image on the left, the non-slip tread in the bathtub. You can also get a non-slip bath mat that goes in, but these treads are really nice. They stick right to the bottom of the shower or tub floor. And so it's very easy to keep the tub clean. There's not water collecting underneath them. They're very simple and can come off if you really need them to be removed later. But this really prevents a lot of slipping and risk of falls. The other picture is just showing how handrails might have been added to a space to give a little bit more support going up and down stairs. It's not always possible to install a ramp, but adding a handrail can be a good addition if not. And then in the picture on the left here, we have the non-slip backing for rugs. So if the person doesn't want to give up the rug or they have a functional reason that they're there, you can add these to the corners of the rugs to help them keep them from moving. This is especially important if the person's using a mobility device, such as a wheelchair or a walker. If rugs are not secured, those wheels can actually catch in the rugs. Similarly, if the person isn't able to lift their feet all the way, these can prevent, again, a really high fall risk. The example of the sensor night lights, these are just purchased from Amazon, relatively low cost, and you can put them all throughout the home where you might need more light as the person's moving and walking through. And then I spoke about raised toilet seat earlier. These are examples of that, some raised toilet seats or adding handles or grab bars to the toilet to help the person be able to push themselves up off the toilet and to make it safer for them to sit down. This is really nice and helpful because it eliminates the need for a person. If someone needs to just a little extra push to get up and off the toilet, without these, it might be you that's supporting the person, but instead they're able to push up and really reducing the physical burden on someone else, which can feel nice for the person to be more independent and a little bit safer for both of you. So some additional strategies that can help in the environment, using supportive footwear. So not using slip-on slippers if the person's moving around the home, things should be secure on their feet, maybe some treads at the bottom. That's around the home. If the person needs specialty footwear, talking with their doctor about what that might be. Making sure that if the person really wants to wear slippers or stocks, their feet get cold, that's more comfortable. Try to get some that have a rubber bottom or tread and that's secure on the foot to keep from slipping. And then if possible, exercise, working with the person to engage in a regular exercise routine for strength, for mobility, balance. Before you do any sort of exercise, you will need to check with the person's medical provider or the physical therapist around what would be safe and how to do that safely. But if the person has a recommended exercise routine, doing that with them can be really helpful. So section 5, the relationship between physical supports and cognitive and emotional behavioral regulation. How do cognition and physical function relate to each other? The brain directs movement and motor actions, as well as our thinking skills. So somebody with brain injury might have impacted both their movement, motor, and thinking skills. Cognitive skills can also affect how someone is able to plan for and follow through on movement. So not just necessarily controlling the movement, but thinking about how I need to move, how I can do this safely, and problem solving. They might have decreased awareness from the brain injury or problem solving skills, which means that if something new comes up in the environment, they don't know how to make adjustments physically. This can especially be true if there are physical limitations. They might not know how to find an alternate route, how to change how they're doing something, how to grab differently if the situation is not the same every time. So cognition can really have a big impact on our physical function. So some strategies that are especially helpful if somebody has affected cognition and physical skills, that person might need extra cueing to use physical adaptation. So they may need demonstration and direct verbal cueing to use different strategies in the space. Step-by-step verbal instructions for movement. So going back to our example earlier, lift your right leg, put your foot in the pant leg and push it through. They might need that level of verbal cueing to be able to accurately complete the task. They might also need some extra time to process directions. So it might be worth giving directions slowly, allowing the person time to initiate and take movement, and not providing an extra cue right away, giving them a moment, as long as it's safe to do that, to think about what you said, process it, information, and then act on it. Things such as direct cues, gestures, and minimal assistance can really be helpful to make the person aware of where they need to move, strategies they need to use, different supports that are available in their environment. And then adding some visual or environmental cues. These are talked about more in depth in the cognition course, but they might need more of these to help with safe movement. And then we're talking about physical skills and emotional and behavioral regulation. Things such as dizziness, vision, and balance issues can increase a person's anxiety and make them more fearful of movement. So when a person has that in place, they might be more anxious. When a person feels more anxious, it's harder to move and they actually are at a higher risk of fall. Additionally, if somebody has a hard time moving, again, if they have hemiparesis, they're not able to move a part of their body, they're uncoordinated, and so things are harder, they drop items, they're not able to be as accurate. That's really frustrating. The more frustrated we are, the harder we have the harder it is for us to be more accurate in our movement, right? And we begin tensing and we tend to struggle more when that happens. So if you're more frustrated, it actually makes your physical skills worse. And in general, if somebody has an impact on emotional regulation because of the brain injury, it can overall just make it hard to be more efficient or to know that strategies are needed to be used. If you're frustrated easily or you're feel very strongly, have strong reactions, impulsivity, that person might not give themselves the time they need to be able to use those strategies. So what do we do about that? One of the really important things before starting is talking through what strategies you're going to use. Plan ahead. This is going to mitigate some frustration. It will also help somebody who's more impulsive because you've already talked through and identified, what do I need to do before I get started? And then decide beforehand how much assistance you're going to give. So again, if somebody has difficulty with emotional regulation, they might not respond well if they feel surprised about the assistance that you're giving. This can also, again, help them feel more frustrated, take the time to process, okay, I do need that much help to do it. I'm okay with that, versus you jumping in while they're doing something, going, oh no, you're unsafe. That can be really startling, alerting, and frustrating for the person. Again, making sure you have enough time so that the person doesn't feel rushed. Nobody feels good when they feel rushed in particular. So making sure that they have extra time to process, to move, to do the tasks, and that's going to help them feel more calm. And then again, environmental cues for safety as needed, visual cues, talk through more environmental cues for emotional regulation, and the emotional in another course, but using those, and especially when the person needs physical assistance. And finally, section 6, we're going to talk about provider self-care. It's really important for providers to take care of themselves. We talked about this in the Brain Injury 101 course. When you're providing a lot of physical assistance, taking care of yourself is really important to increase safety for you and the person, prevent injuries, again, for you and the person, and for you to prevent burnout. Physically assisting someone is tiring, physically exhausting. And if you're doing that a lot and not taking care of your body or your mind very well, it's easy to start to feel burnt out and tired. So what are some things you can do when you're providing physical assistance for a person? Exercise and stretching. So this might look differently depending on who you are, the type of physical assistance you're giving, what exercise looks for you. But keeping your body healthy and strong is really important when you're physically assisting someone in moving. Stretching may also be really helpful, especially again to prevent injury and work out sore muscles. Using deep breathing, this is going to be a common strategy you're going to get used to, right? Deep breathing while you're moving, but also deep breathing after an activity to help you relax, to help re-regulate your body, your blood pressure. Overall, it's really good strategy. Pacing is important for you as well as the person. Taking your time, not rushing, not moving too quickly, especially when providing physical assistance, is important for preventing injury. It is better to take your time and be safe than to rush. Taking breaks. So again, just like for the participant, you might not be able to provide 4 hours straight of physical assistance of heavy activities, lifting, supporting a person. Make sure that you are taking breaks and giving yourself time to recover and rest between support as needed as well. Getting enough sleep and rest, again, restoring your body. Asking for help when needing it. This should be a major takeaway by this point. You should ask for help always when you need it, either if you need a break or extra assistance. Giving yourself time for relaxation, whatever that means for you. And then again, engaging with caregiver support groups can be really helpful, especially when you're feeling more burnt out. So in conclusion, providing physical support assists someone whose brain injury has impacted their ability to move safely on their own. It's important to remember everybody's ability is going to be different based on their injury, based on the activity, and even can vary by the day and how they're feeling. If you've taken nothing away from this course except this, safety really is the most important factor to think about when providing physical assistance. It should be the first thing you're thinking about in making sure that if you're going to provide assistance, that you're able to do it safely. That concludes this course. Make sure that you take the quiz to receive your certificate of completion, and I look forward to seeing you in other courses.